Hey friends, it's Masood. Welcome back to Med School Moose. This is going to be USMLE Step 3 High Yield Facts Part 1. Yes, it's the start of another new video series. If you're brand new to my channel, welcome. My name is Masood Mohammed. I'm an emergency medicine physician and I create a ton of high yield content for medical students and residents, including things like USMLE and COMLEX prep. In the past, I've created high yield facts videos for COMLEX Level 3. I will link those right here. Obviously, a lot of information on those videos is relevant for USMLE Step 3 as well, but I did also want to create more content geared towards USMLE Step 3, which is why I'm creating these videos. Be sure to subscribe to receive these videos and all of my other high yield content. If you've never watched any of my high yield facts videos before, these videos are generally randomized rapid facts, kind of in a flashcard format. I'll put the question on one side, the answer on the other, and it's just random, just really great for rapid review right before test day, really great after a long day of studying, long day of doing questions, reading books. This is another really great resource to review. So that being said, let's jump right into it. So here's the first one. At what hemoglobin A1C level is the diagnosis of diabetes made? And this is going to be a hemoglobin A1C of greater than 6.5. There are, of course, other diagnostic criteria in the diagnosis of diabetes, things like a fasting glucose and abnormal glucose tolerance test, but you do want to know that hemoglobin A1C threshold, and that's going to be greater than 6.5%. Mercury can cause which type of interstitial lung disease? This is going to be pulmonary fibrosis. What is the most accurate test for the diagnosis of myositis? If you've watched some of my Step 2 CK high yield facts videos as well, I've harped on this a lot. A lot of these questions as you go further on the exams are things like the most accurate, the most sensitive test, the most specific test, first line of treatment, gold standard. You really want to read these questions slowly, make sure you're getting what the question's asking. This one, the most accurate test for the diagnosis of myositis is going to be a muscle biopsy. Moving on here, what is the best initial test to diagnose Zenker diverticulum? The best initial test is going to be a barium study. What is the most common type of hypovolemic shock? The most common type of hypovolemic shock is actually going to be hemorrhagic shock. Next one, what is the most commonly affected blood vessel in acute mesenteric ischemia? This is going to be the superior mesenteric artery. The reason being is because it has a really acute ankle and it's a direct branch off of the aorta. So really common for thrombosis to occur there. This is the most commonly affected blood vessel in acute mesenteric ischemia. What medication is associated with Epstein anomaly in neonates? This is going to be lithium. Not really a commonly used medication much anymore, still used in some cases of bipolar disorder. But remember, Epstein anomaly, this is an abnormal tricuspid valve that's abnormally displaced lower down, downwards into the right ventricle that can cause issues with the heart. So lithium, association with the Epstein anomaly in neonates. What is the triad of congenital toxoplasmosis? Some of the information that we see on Step 3 draws from information on Step 1, Step 2 CK, so you may remember this from back in the day. The triad for congenital toxoplasmosis is going to be intracranial calcifications, hydrocephalus, and chorioretinitis. Doing some OB-GYN here, what is the indication for a vacuum-assisted delivery? This is going to be a prolonged second stage of labor. At what age does colon cancer screening start in the general population? Guys, you need to know preventative medicine is super important, getting more important in real life and also very important on the exams. Colon cancer screening generally starts at 45 years old. This is the USPSTF recommendation. There are some exceptions, but generally in the general population, colon cancer screening starts at 45 years old. That being said, at what age does colon cancer screening start in a patient with a family member who had colon cancer? This is a little bit different. This is either 40 years old or 10 years before the age of the family member. So you really want to know those distinctions. General population, colon cancer screening starts at 45 years old. If it's a patient who's had a family member with colon cancer, it's a little bit earlier, 40 years old or 10 years before the age of that family member. Next question here, episodic hypertension is a characteristic of what condition? This is frequently seen in pheochromocytoma. And in that same vein, what is the most accurate test to diagnose pheochromocytoma? This is actually going to be a CT or an MRI of the adrenal glands. There are some other testing modalities out there like an MIBG scan, which is nuclear imaging, but this is actually used to detect metastatic disease. The most accurate test for the diagnosis of pheochromocytoma itself is a CT or an MRI of the adrenal glands. What is the only cause of hyperthyroidism associated with an elevated TSH? This is an important one to know because it is so distinct. It is a pituitary adenoma. It is the only cause of hyperthyroidism associated with a TSH. This is, of course, a hormone-secreting tumor, which is why you have those elevated levels of TSH, and the treatment is with removal of that adenoma. Which has a higher sensitivity for diagnosing infective endocarditis? Is it TTE or TEE? And the answer is actually TEE. When it comes to infective endocarditis, the sensitivity of TEE is about 90 to 95%. The sensitivity of TTE is a lot lower. It's about 60%. Moving on now, what is telavancin? So there are some kind of random medications that aren't commonly used in real life that are on USMLE Step 3. Maybe not as high yield as some of the other information that I'm presenting, but I do want to put them on here so that you guys have at least seen them. So if there is 1 or 2 questions about these medications, you will get them on test day. So telavancin is a vancomycin derivative. It's bactericidal. It works by inhibiting bacterial cell wall synthesis, and it can be used in severe MRSA infections. Again, not something you're going to run across very frequently in the hospital, but it can be used for severe MRSA infections. Some more infectious disease here. Daptomycin is not effective for blank infections. Daptomycin is not effective for lung infections. The reason being is because it has poor penetration into the lungs because it gets inactivated by surfactant. So definitely know that when it comes to lung infections, daptomycin, really not a good treatment option. What demographic typically presents with ankylosing spondylitis? You want to know some of these demographics. It's going to be young males, typically less than 40 years old, are frequently the ones that present with ankylosing spondylitis. You may recall that's the bamboo spine, the high yield images from USMLE Step 1. You still want to know some information about it here for USMLE Step 3. What is the best initial test to diagnose Wilson disease? Again, we got to read these questions carefully. The best initial test is actually going to be a slit lamp examination. Remember, Wilson disease, it's an inherited disorder that leads to abnormal copper accumulation in the body. You use the slit lamp examination to look for Kaiser-Fleischer rings, and slit lamp is actually more sensitive than a ceruloplasmin level. So that's why this is the best initial test. That being said, what is the most accurate test to diagnose Wilson disease? This is going to be a liver biopsy is the most accurate test. Far more accurate than other things like a urine copper level. So you want to know those distinctions. Best initial test is going to be a slit lamp examination. Most accurate test is going to be a liver biopsy. Guys, as always, thank you so much for watching. Click here on the left to watch COMLEX Level 3 High Yield Facts Part 1. Like I said, a lot of that information is also relevant for USMLE Step 3. And click here on the right for another video that YouTube thinks you'll enjoy. Thank you for watching. Be sure to subscribe, and I will catch you in the next one.